committee that has
Yeah, you do. You have my email, right? That would be great. Very good. Thank you, Tara. Efficiency, that's what I like. Yep. Hi, Becky. What?
She's been sending me a lot of emails.
I don't think so.
Oh, the bill thing.
Yeah, no, we're good. As long as there were no issues, it's good to go. Yeah, thanks.
How do you know anything else around here? It takes an act of God.
I know all these people, they don't
Not
know
those
each
things.
So my wife.
That's a lot. I keep looking at the recording.
Calling the Human Service Committee meeting to order for February 3rd. Courtesy of the floor, is there anyone here who would like to address the committee? Seeing no one, we'll move on. Okay. First, the second on the agenda is a review of a donation to children, youth, and families. Let me read this. Received a copy of this from Sue Ondolowski. We have a memorial donation. In accordance with Home Rule Charter, Section 202, Children, Youth, and Families is requesting Northampton County Council's authorization to accept donations in memory of Elena A. Clothier.
The mics are redone, and so there may be some sensitivities.
But there's no one here I can ask. Humor. It's humor. It's humor.
Mr. Giovanni, can't you help fix it?
Okay. Let's get back to this. Ms. Clothier's family designated the Northampton County Children, Youth, and Families to receive memorial donations, or contributions, I should say. The family expressed that the funds be used for any item that the Northampton County Children, Youth, and Families consider is necessary for the well-being of the children in their care. With your approval, please forward this request to County Council for review at the next council meeting. I don't really see a problem with that. Did you want to say something?
Yeah, actually, we found out after the fact, somebody that was adopted years ago passed away, and I don't have details, but after checks started showing up at Children and Youth, we found out that in lieu of flowers, the family asked for donations to Children and Youth. So they called in a panic, and I said, it's okay, we'll take it to council. They will, I'm sure, be very comfortable with accepting that donation. So so I don't have any personal information on the woman who passed away, but I was certainly very thoughtful of her family too.
Well, it's part of council's job for any gift or donation. It's council's responsibility to accept it on behalf of the county. Madam President, would it be a problem if I make a motion in our meeting under new business to accept this, or do we have to wait till the next meeting?
No, you could accept it. I only have a
Oh, it's
question.
on the agenda. All right, I move that this be put on, we vote on this in the meeting.
I have a question about it.
Sure, go ahead.
So it's not a one-time gift. I mean, they're not going to collect it and then present it. So this is a potential to be an ongoing donation?
We had this sometime in the past year, if you recall, for aging. And so as long as the donations, families or loved ones or friends decide to make contributions, yes, those checks would continue. So the ask is that we are able to accept any donations that come to Children and Youth on the family's behalf.
Thank you.
Okay, any other questions? If not, thank you, Sue. We're going to move this on to the meeting.
Sure, thank you.
And then next, we're going to go to, I believe it's, yes, report from Greystone. So,
Before Jen comes up, I just wanted to give some exciting news about Greystone, so I figured I would present that first. The county executive, after the holidays, he and I had discussions about Greystone, and we are very excited to let you know that we are in the process of forming a daycare for Greystone employees. We've talked about this here in the past, and much of council has seen the 40-some page PowerPoint presentation that Human Resources did with all the recruitment activities we have done since January of, I think, 2019. And this really was one of the last pieces of the puzzle. And so I don't have a whole lot of details. My early intervention folks have been instrumental in helping me identify possible partners. And so lots more to come, but we think certainly this can help with retention for staff, but even more, not more importantly, that's not a fair statement, but we think it will help even more with recruitment. So maybe we'll have some current staff who take part in it, but, and anybody who wishes to will be able to, but we think it will be an excellent recruitment tool as well. So the regulations to start a daycare are enormous, like all things in human services, which is why we are going to partner with someone who has been there, done that, and done it well. So stay tuned, more to come. I just wanted to let you guys know, but I'm happy to try to answer any questions.
Yeah, go ahead. Oh, I'm sorry. Ms. Rinsky.
So my question is, would the daycare then be county employees, or would it be a private daycare that comes in and, sets up?
So we will contract with a private daycare. The advantage of that is they would be so many new full-time jobs that would have to be created, right, to be county employees, and none of us are daycare owners. So contracting with someone who has already done this will just be a much simpler process. And ideally, it will be someone who has at least 2 locations, because they will, and that's ideal, I'm not saying that is a set in stone, but they will then have had experience expanding. And so this will be really no financial risk for someone to try to expand their services, because, we have the space and it would be a contract with the county, so.
That's great. I was worried about that setup.
Yeah, I've tackled a lot of things, Mr. Rinsky. I don't think that one is.
Okay. Mr. Lyon.
Some of the questions you just got asked, thank you. So the facility is going to be at Greystone? It's
The daycare facility,
The
yes, it will be on the Greystone campus.
It'll be on the property.
We're exploring both options of having it inside Greystone and renovating existing space for it, which would, we think, be fairly easy, but again, once we have identified a partner and we can tour some spaces and things like that, those folks will help us identify that better. But we have also explored the possibility of adding modular-type buildings, which is a lot more cumbersome with zoning in Upper Nazareth, shall I say. So we're simultaneously exploring both options, and probably the path of least resistance is
So if
way
we
we'll go.
contracted with somebody that has existing facilities, there might be an opportunity to have our employees, say they live closer to one of those facilities. Would we look into that? You could either come to drop your kids right where you're working, or if, God knows, one of the facilities might be close to an employee's house. So that would be something I guess you'd work out. The other thing, so it would be accessible to our employees of Greystone, or all our employees of Northampton?
So this is a pilot project starting with Greystone, but great question. One I am sure I will get tomorrow in my office. And so, which is a fair question. And so obviously Greystone at the moment has the most significant need. And so we're gonna try it there. But if it's successful, daycares nowadays, and I'm sure it's been this way for a long time, someone who's experienced in, getting, you guys know about the star ratings for various things, so daycare have star ratings too. So if you achieve a star rating, then you are eligible to receive state and or federal subsidy, right? So if I'm a low-income mom working at Greystone, if I applied for subsidy and was eligible, then the daycare can receive that subsidy. So in the long term, it might be county funded up front. The long term, hopefully we'll be able to offset a lot of the costs. We think that the savings in employee retention and recruitment and not having to have as much staff turnover will certainly pay for itself in the end. And And I lost track of what your actual question was, Mr. Lott, I'm sorry.
Well, I guess what you said.
Oh,
is
for
that
Greystone, so
this
it's, so
is
if
the
it goes well,
starting point.
if it goes well at Greystone and it's a model that can be replicated, it's absolutely something that, you know, it could be considered. But, so this will be the pilot spot and we'll see how it goes.
Thank you.
You're welcome.
But some experience I saw with Lafayette doing this and bringing it in, it's a big plus for you. You know, LVCC is who they work with at one
Okay.
point, and then they change with somebody else.
Okay,
So kudos for even going in that direction. I mean, that's a big plus with working families, so I applaud you for even thinking and going that direction. Thank you.
you're welcome, thank you. It's a huge lift, but I just think we've talked about it for a long time, and it really is one of the last things, you know, we haven't tried. We talk about that here all the time. Please, if you have any ideas, tell us. You know, short of standing on our heads in the parking lot, we've done everything we can. Happy to provide our PowerPoint for the new folks on council as well, if you'd like. So, big lift, but we think that the benefits will just be, there aren't many employers who offer this, and we have, you have to think of the hospitals sometimes, but it's also not necessarily at no cost to employees, so we think it could be a huge selling point. And since we can't compete with $30,000 sign-on bonuses that Lehigh Valley is now offering, this is our next
Are there any other
project.
questions for Ms. Wondolowski on this topic? I just want to say good luck. I think that it's worthwhile pursuing. I know for years and years, the county that was thrown around doing amongst other things, a daycare out at Greystone. And I'm sure the solicitor's staff will be looking at all the liability. Usually one of the things that scared some of the past administrations.
Correct.
I think it can be done. And since you're talking about getting someone, like a contractor, as a contractor, so really the risk is on them. And I agree. I mean, we've got to try what we got to try. And so I think it's a great idea at this point. And good luck.
Thank you.
Did you have anything else you want to say on Greystone?
No, I will let Jen speak now. Thank you.
Thank you. Hi, Jen.
Hi. For the new people, I'm Jennifer Stewart King. I'm the administrator of Greystone Nursing Home. I've been there 16 years in various positions. I also worked at other nursing homes prior to that. So I come with some experience knowing Greystone as a whole. I was hired as the administrator in 2019, and then COVID hit in 2020. Gained a lot of experience. So I did a piece of paper because I know we talked about redoing the report. So this kind of gave a blank idea of where we want to add and stuff. There is no financial information on here as we're closing then the end of the year book.
Sorry. I'm very, very, very sensitive.
So I will have more information to come once we close out financials. But there is no county contribution for the last year. You can see this is from November, so I can tell you November and then I can give you today's. So census in November was 475. Today we are 443, which is a strategic move on our part to lower census to make our PPD go up. The lower the census, the higher the PPD. Open beds in November were 213. We had 267 referrals for November. We only admitted one emergency admit. We had a wait list of 35 in November. We have over 60 today of people waiting to get into Greystone. The discharges were one to home, one to another nursing home or assisted living facility. And unfortunately, we did lose 6 of our residents during that month. Yeah. The average PPD for November was 2.65.
Could you please take a moment with new people, because I want, that just part of what I want to do this year with the committee is, I've talked to the director, is sort of take a moment to explain certain things.
Sure.
Because I having been in the field, I know we live on, we live on these, what do you call that? I lost.
Acronyms.
See, I
Live and die by
I
them.
even clenched my mind of the word acronym, because half our meetings would be acronyms, and people thought they were from another planet. So if you don't mind, like.
Sure.
if you could
So the
explain.
PPD is the hours of patient care per day. The state says you shouldn't be below 2.7, and we are. In November, we did not have any COVID. Today, we have 45 positive residents and 13 staff members who are positive. Tower 10 was in process of being made into a fully functioning negative pressure. Today, it is fully functional, and we have those residents who are positive up on that unit. We continue to educate staff on the vaccine mandate. That was in November. Unfortunately, we did lose quite a number of staff who chose not to get vaccinated. We continue to hire and market to staff. I took over hiring in November and then into December. I offered 24-hour hiring, so I would talk to people at all hours just to get them in the door. Currently, we do have the National Guard helping us assist with testing because one COVID case is considered an outbreak. So we do have the National Guard in by me asking them. So that is something that Department of Health puts as needs assessment out for all long-term care, and people can take advantage of it. So that is something as the administrator I chose to do. I asked the National Guard to come in. So when the National Guard comes in, there is also another company. You've heard me talk about, and these are acronyms, which RICBs or the RCAT teams. We talked about those before. Those were set up at the beginning of COVID. And Lehigh Valley was one of them, and then Geisinger became the next RCAT or RICB team to help nursing homes make sure they have everything that they need to succeed with COVID. So now they've gone to a new company called AMI. AMI comes in with the Guard, and just to look over the nursing home, make sure that they have everything they need. They have asked of Dawn, myself, and pretty much every department, all the reports, numerous amounts of paperwork. They have walked through the facility. They have looked at everything, under everything, and I am proud to say that the only issue at Greystone that they found is staffing.
If it's okay with you, Jack, are there any questions up to this point? And Mr. Kusick, and then John, go ahead.
On the PPD,
Yes.
for November, you have 2.65.
Correct.
Now, I just looked up the latest Pennsylvania Department of Health numbers, and it has you at 2.45.
Correct.
So that is correct.
Correct.
Okay. I guess my question is, to what do you attribute the decrease? And do you believe some of it is related to the vaccine mandate?
Yes, we lost 51 people to the vaccine mandate. So they are currently on a 2-week LOA to make sure that their decision is their decision. So they have the opportunity to still be with the county, but on a leave of absence to get the vaccine if they want to, and then they come back. But and this is one of the things, I cannot have anybody in my facility who is not vaccinated, or I will lose any and all funding. So it puts us into a very challenging position. And that is why it was my duty to call, and say, hey, you have these tools out here, please send me AMI, make sure we're doing everything we can, and I'd like to ask for the Guard's assistance.
Okay. Thank you.
I have a couple questions.
Sure.
You said there's 45 current positive patients inside the Greystone?
Yes.
Is that higher than what you've had in 2020, in the beginning, during 2021, or is that pretty much on average with what you guys have been seeing?
It's lower.
It's lower?
It's lower.
Okay.
Yes. So the Omicron variant goes through a facility quicker, but its recovery is faster. And most of our residents are vaccinated, so we were able to have them recover quickly. We did unfortunately lose 3 people who were on hospice, who also had a diagnosis of COVID. So every life we lose is terrible, but you're welcome.
Mr. Brown.
Currently, what is the reimbursement rate per bed, per patient?
$220 a day.
220 per day.
Yeah, I think it's 21 cents too, like 220.21.
220 per day,
Is that for skilled, or is that
That's the Medicaid rate.
Medicaid?
Medicaid rate.
I'm sorry.
Yeah, no, thank you for the clarification. And you opened your comments, not having financials, but mentioned that the county, there's no county contribution in 2021.
Correct.
For the facility. What additional funding came in that was not county contribution that made up for the difference between the Medicaid rate at 220 per day based on your census and the operational costs? Because unless you're with the 200, I don't know what the cost of the 200 plus employees are that you're not paying to offset some of the operational costs.
Right.
But in numbers I've run before, you can't, you don't find a level without having supplemental income or revenue of some kind.
Well, and we had the American Rescue money, which came in for 2020, and then which also came in at the beginning of 2021. So that was purposely to help long-term care pay for those beds that weren't being occupied. So that's where we did get that extra money in.
Great, and how much was that in 2021?
Mr. Barron,
Yeah.
can you illuminate that? And I know that
It was just a hair over $7 million, and then the county kicked in another $2.1 million from our ARP money to pay for the incentives that county council approved. Pay for the incentives that county council approved with regard to the hiring. The hiring bonus, along with the hazard pay that council was kind enough to extend. So we wanted to make sure that we had that covered and it didn't impact the nursing home in that regard.
And is that 2.1 million continuing for 2022?
We haven't made any decisions
You
on
haven't
that.
made that decision yet.
That was a
Okay.
one-time situation.
And what, for 2021, I apologize, what was the operating budget for Greystone?
It was
70,
70.
78, 79?
No, 72 or 73. And the reason it was lower was because we had our census down. We did get some money back. And the question that you had asked initially, Mr. Brown, was about how we were able to save money. As you know, we budget 85% for our positions. We do have a vacancy factor built in. However, we haven't been able to hire at the home. And as our census comes down, obviously we don't have those expenses because we're not hiring people. We also make assumptions on fringe benefits, pension contributions, and all the things that go into our benefits package at the home. So when we don't make those contributions because we don't have a warm body in that position, that also goes into a savings that you might not see until we close out the books. I hope I said that concisely enough.
So so in 2021, the budget required 9.1 million of supplemental revenues to keep it balanced for the operations of Greystone.
That is correct. And that was because of the census being lower, the federal government realizing through Medicare and Medicaid, and then Medicare and Medicaid made up the difference per bed.
And is there for the supplemental income, for the ARPA money and so on and so forth, is there a drop dead date when that money will no longer be available to the nursing home for making up for the shortfall?
So I don't believe there's any additional money for 2022 that's coming in. However, Greystone was able to maintain, outside of the 2.1 million that the county did put in from our ARP money that came in directly, Greystone was able to maintain a fund balance, I believe, of approximately $5.5 to $6 million. I don't remember where that fell. We anticipate, I believe, $3 million going into the home from that fund balance, which will leave us positive $2 million at the end of 2022. So we are not anticipating a county contribution for 2022. However, depending on where our census goes, what we do with the number of beds that we have, along with being able to hire people, retain people, and we could exhaust that waiting list tomorrow. The problem with that is, from an operational standpoint, is we don't have the people to actually take care of those folks, which would bring down our PPD, which would bring down our star rating. So it's, right now, it's a balancing act. Did I say that concisely enough? Yeah.
Well, thank you for that. I appreciate the clarification on that. Coming back to Jennifer, one concern I have with the state mandate is 2.72 nursing patient hours per day.
2.7.
2.7.
Correct.
And it's dropped to 2.45.
Correct.
There's a risk at some point, potentially, that the Department of Health could pull the license from Greystone and shut it down because of the not meeting the standards over an extended period of time. Obviously, with COVID, there's some leniency in that, but the question I have is, where is the plan to get back to the 2.7, or actually that's low compared to other nursing homes?
Correct.
With that, and what is the timeline for being able to do that?
Well, we work on it every day through the hiring process. Now we finally were able to get the daycare, and we think that's going to be a huge marketing idea for us. I am reaching out to the agencies to see if we can be a little more competitive with the agency rates to get more agencies in, because we compete with profitable nursing homes who have unlimited amounts of money to keep throwing at agencies. So you talk about price gouging. Well, this is something they need to look at. And I have heard that they just want to let it play out and see what happens. So I am in touch with DOH for the last couple of months. Every week I give them my PPD, and I give them all the efforts that we do. I have phone conversations with DOH currently going on. Sue is a part of them. So again, we have tried and done everything, and we will continue to do it. And that's why we are strategically bringing down our census to make that.
Okay, so your answer is to bring down census.
Correct.
Which further depresses the revenue generation for the nursing home, which puts you on a downward spiral, as I think Mr. Barron mentioned. It becomes a downward spiral, and
Correct.
it's hard to get out of that. So what I'm hearing, I just want to make sure I understood what you said. Basically, the strategic plan is to lower census, hope that hopefully we'll get a daycare option available for employees, and that would be a huge incentive in the marketplace overall. But I'm concerned that you're not on track to get it done now. And when will that shift from the Department of Health and begin to pull back on the leniency that the facility is currently under right now? So I'm not really hearing any definitive strategic plan. You're doing more of what you've been doing.
Right.
And I applaud you for that, going through, the COVID crisis, and I absolutely understand and appreciate the hiring challenge the county has relative to the private sector. That being said, that doesn't change the fact that we have to do something. We have a short window to be able to do it, or eventually this facility will implode on itself, just from the weight of the size of it, the challenges, and when the rescue money dries up and there's no excess money to be able to pump into the facility to keep it afloat, it'll just continue to exacerbate the problem. And at 2.45 per day, I don't know if that's even acceptable to the Department of Health, because we are talking about, you said you have 443 as a census today.
Correct.
What is the quality? I don't need you to answer this today, but the quality of care going to those patients is not going to be there at 2.45. It's hard to be there at 2.7.
Right.
So again, these are just the underlying concerns that I have about the facility.
So when I took over administrator, I made my promise to be hiring, because when I walked in, there were 300 positions in nursing that were not filled. So we already started in the hole. So I've been digging out since then. As far as the DOH, I am in constant contact because they know how valuable Greystone is to the community, that we are getting phone calls from the hospitals because they are backed up. They can't get rid of their patients because Greystone personally is not accepting anybody at this point. So we're trying to figure out that maneuver, and have done so much to get staff in, and I'm going to continue that fight. And I'm partnering with the DOH, and before they take your license away, you go through a provisional status, which many nursing homes have before, but we have not been at that point. I work very closely with the Lehigh Valley DOH. So as of right now, I can say, as far as the care for the residents, so PPD in this state is very strange. It only accounts for the care given by what they consider direct care workers, which is a nurse or an aide. They don't take into account the therapy people that are with them, that are feeding and changing and walking and doing things. They don't take into account my ancillary department, who have all begun and upon hire are made to be, they go through a course to become feeders. So every afternoon or for breakfast and for dinner, those ancillary people go up and help feed so that everybody is taken care of. My ancillary departments answer all bells so that they can take care of the things that are non-nursing. They work extra hours. I have the maintenance department who helps out in the dietary department. So I think Greystone is such a community that that's what we're there for, to help each other. So while it doesn't reflect in the 2.7 and we're 2.4, we are not limited by that. We are there to help, and we do it. And we make sure our residents are safe.
Thank you.
Yeah, there's some others. I just want to say, there's a lot of things I can't speak to with some knowledge and experience, but Human Services and Greystone particularly, I can. This is probably the most challenging time for this nursing home. There have been challenges over the years. And without taking a lot of time and getting into deep history, I would say that we're always going to be blessed or cursed, however you want to look at it, which side of the coin, with the fact that our Greystone has always taken on the sickest people and the most needy of care, of skilled care. And I remember a time when we had 90 people, 120 people on waiting lists. And I'm sure others that have been around remember that too. And the state reimbursement was such, it worked out. And one reason was the privates, many of them wouldn't take the rate.
Correct.
They wanted the people that were relatively healthy, and if they could fill their bed with them, they made money.
Right.
We took the people that didn't make anybody any money. And now, as someone who's staunchly defended Greystone and continued to, I was always nervous because I was afraid if we ever went to the privates, there's no guarantee. Privates work off of money. Now, could somebody, if Greystone closed, could somebody get a home if they didn't have money? Yeah. They could get a home maybe in Lebanon County, or they could get a home up past Scranton. But what does that do to their 80-year-old spouse? What does that do to the family? There's human dynamic in this and personal dynamic. I know this is a tough time, and I'm hoping that we can get through it. I hope that whatever American Rescue Act money is available is used to help. And I know that's not a long-term solution. It's not a long-term solution. But I've even argued with economic development that the fact that I'd like to see more of the money that can possibly go to human services as opposed to businesses. I mean, we've been very kind with businesses, and I don't say that's bad, but this is critical. Yeah, I mean, the staffing, and it is a balancing act, because the more, as Mr. Brown, you pointed out, the more people that we close beds, because I remember I closed beds back when the state paid us a nice bonus to close some beds. Then your ratio goes and the amount you could get reimbursed. So Greystone is one of those operations where it's very tricky. You got to match. It's not a one-for-one. We get rid of 10 people, but we still need X amount of staff, and that's been over the years. But I mean, I'm excited to hear about the daycare. And Ms. Wondolowski and I have talked about this, because she knows my feelings and passion about Greystone. And I understand too that we have to take this seriously as far as money, shortfalls. Now, for me personally, I don't have a line in the sand on how much county contribution would go to Greystone. It's like, what did one Chief Justice say? Can't define pornography, but I know it when I see it. I'll know what the line is in the sand when I see it. And so I got John to laugh. That's amazing. But anyway, the thing is, no, but it is, I would say, based on my experience, it is the most critical time I've ever seen in Greystale's history. And I don't know what the final chapter is, but I've said to Sue, I'm open personally as a council member, excuse me, to try anything. If it works, great. If it doesn't, chuck it, move on to the next. But I felt confident in talking to her that they're willing to try just about anything. And I don't know what the answer is.
Right.
I wish I did, but I just think that the issues you brought up and we all are seeing, I'm hoping they're short term.
Right.
But as it was said, we can't compete with a $30,000 or even a $20,000 signing bonus. Now the federal, and I'm going to get to Mr. Myers, he's been waiting patiently. You alluded to this, but I follow the state and federal things on cable network and C-SPAN and whatever is going on to the point where my wife leaves the room. I understand that Wolf has said is directing money. Now, I don't know, I thought it was long-term residents. I know that's hospitals too, but there's going to be specific funds. And also, I believe from the federal level, they're looking at that because you're not alone in this.
Nope.
We would be, any of those things, if it applies to long-term, just because we're public, that wouldn't exclude us, would it?
Correct.
Okay.
Correct.
And as far as the vaccinations go, didn't the state mandate that people get the vaccinations?
Yes.
So it's not really like you have to have a choice in this.
Right, it's
If you
CMS.
want to keep the thing open, you got to tell people if they don't get vaccinated, they're
Correct.
gonna go.
There was no choice, right.
All right, but yeah, I'm sorry for taking a moment there, but I just wanted to fill out the Greystale narrative a bit because it is a complicated process out there, very complicated, and wish it wasn't, but it just is. Okay, Mr. Myers, I apologize.
Thank you, Mr. Chair. I guess I can answer the one thing I heard that the governor was speaking yesterday, but that's, he can put all the money out in the world, but if that Republican legislature doesn't pass it, it's not going to do us any good at all. I mean, that's the issue we have right now. Now, Greystale on a whole is not alone in this problem.
No, we
As
are
a
not.
man who spends his days, before I got my elbow fixed, running from nursing home to nursing home, whether it's ProMedica, Manor Care, or Country Meadows, there is a huge hole in trying to find staff.
Administrators are dropping.
Exactly, which is not just locally, it's nationally. We've heard it several times that no one wants to go into the lawn care business. So let's not sit here and play games, and I'm a little surprised, but I shouldn't be that, it's February and already seems like the other side's gonna start attacking your organization at Greystale. And I, for one, don't have any plans to do anything but keep it open because the fact that several years ago, the county voted to keep this thing the way it is. I've had several family members, I've had close friends, and people that I know that need a Greystale. It's important to our community because I come from a community that relies on Medicare. And I will be their torch carrier to the day I die. So whatever we have to do, we have to do. The numbers that the state's throwing out, we've heard it for the last year, are ridiculous because you can't staff what you can't staff. You can throw it to 277, you can throw it to 1.5. If we can't get the people, what the hell good is it gonna do? The state needs to look at it along with the huge problem that we're having with, like you're saying, agency. That's in the state legislature right now trying to figure out what they're going to do because if we leave this little area here, and I've already gotten reports from friends of mine in the Pittsburgh area that some agencies are getting $500 an hour.
Yep.
That's absurd. So this is what we have to deal with, and that's something that we, in reality, need to understand something. We got to come up with a working solution that works for our people in Northampton County, be damned everybody else at this point.
Right. If the hospitals are offering these huge bonuses and they still can't get staff.
They can't keep staff.
All right.
They can't get nurses.
All right, any other questions on Mr. Lott?
I think while this is all being stated and talked about, this is not a short-term problem. Like Mr. Myers said, this is industrial-wide problem. For our county, it's not short-term either. I've been talking to some union reps that have represented the workers there, and this problem really started when there was a move to shut, in what I've been told, and there was a move to shut Greystone down. When that happened, hiring stopped. Hiring stopped. We started using temp workers. So we lost a large time frame of not hiring people. Then that was trying to be changed. Lo and behold, come the pandemic and everything we're up against now. But I think it's needed to be said. This problem started when they tried to privatize this. They stopped hiring people. They forced this into, they started using temps. Temps services realized they got these hospitals and nursing home, and they jacked the price through the roof. And now, so in Lehigh Valley Hospital is dealing with it too. You read it in the paper the other day. Their hospital up in Monroe is almost losing accreditation because they had temporary people. They don't want to pay the outrageous cost of these temporary services. They figured it out. The hospitals played into these temp workers, nursing homes played into these temp workers. Now they control the market and they're taking advantage, they're gouging us. But this did not start now, this started when from what I've been told, we stopped hiring when we were trying to sell that Greystone. So just a little history. If I'm wrong, but that's what I was told, and I believe it was a very knowledgeable person that gave me that information that represents workers up at Greystone, because they were very aware of the lack of hiring. So I just wanted to put that out there. Thank you.
Thank you, Mr. Lott. And I think too, let me just make an amendment, then I'm going to go to Ms. Hefner. At the time, we had the huge waiting list. We had 700 and some beds, and that wasn't enough. Now, going forward, I'll borrow a term from the private sector. I don't know, even as much passion as I have for Greystone, the new reality is, I don't know if we need we don't need 700 some beds. Times have changed.
Correct.
I mean, and you have to keep up with the times. Do I think we need some sort of facility? Yes. Do we need the facility that we had in 1995? No, I don't think so. But we're sort of trapped, unlike Cedar Brook, that spread out with buildings when Thoder Tower was built. It was sort of a monument to the past. I mean, it was great when it was built, but now we have this facility that we have to maintain, even if we don't need all of it. So I understand. I mean, we have a challenge. I think both the administration and council going forward are certainly going to be challenged with Greystone as an entity and how we're going to handle it, staff it, right-size it. But it all comes together at some point. Ms. Vargo Hefner has been waiting very patiently.
Impatiently, thank you, Mr. Hefner.
Well, I see the president of council, they don't like to wait, so.
So I don't want to be political, I want to be pragmatic. The other day, CCAP had its Human Services Committee meeting, and I believe Mr. Cannon was a speaker. Now, I wasn't at the meeting, but I did speak to him directly. Is he PACHA president, or he's part of a different group? But I think
He's PACA, right, he's the executive director of PACA.
So he seems pretty committed to assisting and supporting all counties keep their nursing home. And he has echoed a lot of what has been said here today in terms of the price gouging, in terms of options. They're looking at statewide options to support some of your local options for retention. I heard about potential tax rebates for folks who are entering this workforce or this specific workforce. My first question is, have we been affected by price gouging from any agencies?
Yes.
Okay. And is that current, like these three entities that you discussed before, is that part of it, or is that the Lehigh Valley, the Geisinger, and the third entity?
No, so they were.
Or are they separate?
They are separate. They are a group of people that the Department of Health and the state Human Services set up to assist long-term care on finding, like, what are your problems going on in the nursing home? Is it truly just staffing, or are there other issues going on? So that's what I'm saying. When they came in, they looked at all our documentation. They watched the videos of council. They looked at everything, and they could not find anything that we are doing wrong except for getting staff in.
I think it would be helpful if you're going to do a financial report to do the overall financial report, but potentially for our next meeting, to talk about some of the financials that directly impact, such as how much you've had to spend additional on some of these agency nurses, because I hear there's just a huge problem across the state. And I'm not saying that makes up for our own problems, but that doesn't help the bottom line. I'm concerned that you say our therapy time does not count.
No.
Because when we hired them, that was the whole premise, is that into DOH for nursing care.
Right.
So help me understand that.
So when you talk about the hours of care per day, it is only the nursing staff that count towards that 2.7. So therapy's here, and they are a tremendous team that they are helping assist in feeding, transfers, besides doing their own work. They are assisting us in everything. But those hours that they give us don't count because they're not a nurse and they're not an aide.
So what do they count for? Because again, when we hired them, we said they would count toward the bottom line.
Well, no. So their therapy hours count towards the bottom line. So this is extra what they do in assisting us. So when they came in and did the presentation and they saved us all this money, they are doing that in adjacent to assisting us with the feeding and, taking people, doing their ADLs with them. It's just an adjacent to. So they continue to do their job for us, plus more.
Mr. Brown used the term strategic plan. Do you have a strategic plan? Because I'm assuming that this isn't a strategic plan. These are just some stopgap measures to help right now. Do you have a long-term plan that we're not aware of? Because my understanding of a strategic plan is a lot different than what we're discussing here today. I'm hearing that we're still in a crisis, and we're trying to do some crisis management. So I just want some clarification.
Yeah, I wasn't sure if Jen would want to say it, so I wanted to. You're correct. We are in short-term mode to get through the next few months. And I think what we have talked about is, as we see the census come down a bit, it can't be a forever thing, obviously. We have to figure out what the right number is for Greystone, and what the right number is then will determine how many staff are needed and operating budgets. And so if you're looking for a long-term plan, certainly COVID put a monkey wrench in that. But so for now, it is short-term measures. We need to get through the next few months, and then we'll be really formulating some new long-term plans and talking to council about that.
So that's an important clarification. Because
Absolutely.
I mean, when I think strategic plan, this is not the kind of stuff that I think you're talking about.
No, I think the strategic plan, so the 45-page PowerPoint that Human Resources has done to recruit for 3 years after, again, we inherited 332 vacancies in nursing when this administration took over, that's a strategic plan, right? That has been going on for years. This is absolutely all of the things we have been doing and then some to get us over the hump.
Okay, so the next question, in my conversation with him, he intimated that while DOH is the overseer, and they are the ones that give these ratings, yes, no, up, down, they're not necessarily, I guess he's talking state level, not our individual liaison.
Gotcha.
Helpful in this project. What he explained to me is that nurses aren't driving the numbers, that epidemiologists are actually driving some of these numbers because they're more worried about transmission at this point. And so we're not looking at real nursing care per se, like, again, not long-term, short-term. So I'm concerned, who else then is an advocate? Because if DOH is just coming in saying yes, no, and checking boxes, you have to work with them. But who else is there being an ally? And where do we need to look for support in the state other than that? Because again, we are not alone. You're our responsibility.
Right.
We have to deal with Northampton County. And if I heard that Greystone is horrible and everybody else is figuring it out, I would be angry.
Right.
But I'm not hearing that. I'm hearing it's critical across the state. And I care about how do you eke those numbers up a little bit. But who can we get to help us with this?
So
Part one.
Right.
Part two, is DOH able to make agreements and some short-term plans with you? Because we're not at a corrective action plan yet, are we? No? So why can't we work with them to create a pilot plan to move this forward instead of being an antagonist with them? Those are my questions.
So there are two different, right now, there's like two different branches going on with DOH. There is the epidemiology, which Dr. Miller heads, which I talk to, and that's who Sue and I communicate with AIM and the National Guard. So we are looking at different options. And then you have the regular DOH, which is the, come down, we're going to cite you and do everything else.
Surveyors.
Correct. So that is the Lehigh Valley branch. So they are both part of this, and they know what's going on in nursing homes because they're like, Jen, it's okay. Because I talk to them and I'm like, okay, what am I missing? And they're like, you're not. You just got to stay the course and keep doing what you're doing. Something's got to give. And I don't know what that is.
A couple of meetings ago, we talked about other nursing staff that are on the premises but not necessarily jumping in and doing nursing care. Have we looked at pulling them in to increase the numbers?
Yes,
Is that happening or is it not happening?
it is happening.
Again, I think we'll do anything we need to do to be helpful, but I think today's meeting was much more helpful in terms of giving us numbers. If you do have a plan of how long you're going to stay lowering, how you're going to try to increase the census, if there's a grid of hires per, and then we leave to increase the census, I think that would be helpful information to have.
Okay.
Because it's all just stuff on a piece of paper until it becomes live in my mind, So rather than assuming that you're just going to kill the census, and again, if DOH is not saying, oh, you better hurry up and get those numbers up, they're not looking to pull any money at this point. There are no threats at this point. The concern is the quality of care and getting it right, correct?
Correct. And that is why we are doing so many things with the ancillary departments.
Are we anticipated to lose any other staff members?
It's a constant struggle.
The final, ultimate, have we met the deadline mandate, or is there another mandate date coming?
So there's three. So this was the first one on January 22nd, 27th, then there's one in February, and then there's one in March. So we're there. We're at 100%. So when they calculate the vaccines, so they take your people who are vaccinated, and we're at, let's say, 90%, which is where we are today. Then they take any pending or approved exemptions, and that gets added into the 100%. So if they're approved, DOH looks at that as part of 100% vaccinated status, and then you're left alone. So that's what we continue to do.
Thank you.
Let me just say.
I would encourage you to please call Mr. Cannon if you have not
Oh, nope.
already. 'Cause
We're
he
in touch
seems
with
to have
PACA.
A lot of good information and ideas and.
And we do, so I communicate with several nursing home administrators who, we commiserate, and just try to feed off each other on what are you doing, what are you trying? And they're all in the same boat, and it is unfortunate that there are several nursing homes in this right area who have lost administrators because we just don't know what to do anymore.
All right, so, I'm sorry. Just so my fellow council members understand, every month, I'm gonna have Greystone on the agenda for the Human Services Committee. So we'll have the opportunity to dig in and in the meantime, send a memo or a call, to get some information or have it available. I would say the next time you come, I know Don's here, but could Brian come too?
Yes.
Okay, good, because he'd be very valuable with the money, the figures. I don't want to take too much time, because part of what I wanted to do was have each meeting have one of the divisions other than Greystone come in, explain themselves, and take a short time, but I don't want us to run past, at this point, quarter after. So are there any questions? Yeah, Mr. Brown, go right ahead. Oh, wait, does anybody who hasn't had a chance to ask have a question? Otherwise, Mr. Brown, go right ahead.
Yeah, Ms. Walendowski, could you clarify the statement? You said you inherited 332 open positions. Were you specific at Greystone?
Yes, just at Greystone, that was
And
nursing
what
positions.
time frame was that?
January 1st, 2018.
I would ask you to go back and take a look at that, because the census at Greystone was we averaged 665. That
Correct.
was my administration. We had 40 open positions, so I believe you're inaccurate in that number. Thank you.
I am not, but we will get
All
that
right.
clarification. There's also differences with position control, full-time, part-time, but not a
Why
problem.
don't you put that together, and then at the next meeting, if that's all right with you, Mr. Brown, or in the meantime, send
Sure.
it to council, it's your prerogative. If then that's it. On Greystone, I am going to thank you, and that was very, and I'm trying to think if there's something you could put together for us, but it would be exhaustive, because I remember the regs book I used to go through and
Right.
bang my head against the wall, but I was much younger then.
And if there's something that you want in the new presentation, just let me know, because I know you had said you'd
That's
want
fine.
more or
We'll let
less.
you know.
Yep.
And council certainly let Linda know, or get it to me, and there's specific things maybe we could get them to bring in. But I plan on, coming in and keeping us updated, and let us know what we can do. But thank you. And
No, thank you all.
Thank you. And I'm going to move on from a report from the Area Agency on Aging. And again, this is sort of a refamiliarization for some of us, and some of us it's brand new. So if you could just sort of give us, without going too deep into the weeds, because there may be a few questions, a portrait of your division.
Sure. Hi, I'm Laurie Greco. I'm the director of the Area Agency on Aging. I've been the director there since 2018. We serve older adults, 60 and older in the community. We coordinate in-home services for folks who need it, protective services investigations. We do functional eligibility determinations to see if folks are eligible for the waiver program. We host the PA Medi, which used to be the Apprise program, assisting folks with Medicare enrollment questions. We host the senior centers, and we have a caregiver program that supports and reimburses caregivers in the community for folks 60 and over. So I'll start giving unit updates, and then I'll kind of go into what we've been doing last year for vaccine efforts and meeting some of our agency goals. For our senior centers, they reopened in July of 2021. They had been closed since March of 2020. Our senior staff in 2021 have put together over 1,300 goodie bags that included activities, personal hygiene items, shelf-stable food, and they were given out to senior center participants through drive-through events and delivery to their homes. Over 1,100 food bags that included fresh and shelf-stable foods to senior center participants, again through drive-through at the centers and delivered by the care managers. And 600 holiday goodie bags with holiday treats and fresh produce, again distributed through the senior centers. We have a tablet lending library. We were able to purchase 156 Surface tablets, and our senior center staff are providing classes to their participants to teach them how to use them, to help them stay engaged through social media and online classes, because we are only still open at a limited capacity in our senior centers to keep folks safe and healthy. We've provided over 26,000 congregate meals, either through delivery when the centers were closed, takeout, or in person in 2021. We provided flu shots to center participants at the Cherryville and Slapebelt centers, and 50 participants were able to receive flu shots while at the centers. We were able to continue our health and wellness programming, either through limited in-person or remotely, and we were able to get 271 participants engaged through our health and wellness programming. And we hosted the Senior Farmers Market Nutrition Program, where folks 60 and over can get $24 worth of farmers market vouchers. And we gave out over 6,000 with a 73% redemption rate. And we did help increase that redemption rate during COVID by having pop-up farmers markets at the sites of voucher distribution so that they could get their checks and then just purchase produce right away. Our options program currently has 509 seniors enrolled for services. We continue to have no wait list at this time. Our options care managers delivered over 80 food bags to older adults in the community that were put together by our senior center staff. They also distributed 40 emergency bags that contained blankets, hats, gloves, socks, emergency preparedness guides, and resource information regarding shelters and warming centers for folks to get them through the winter months. Our assessment unit, which completes the functional eligibility determinations for waiver, we have done over 2,100 of those in 2021. And they need to be completed in a 10 business day turnaround, and we are over 98% compliant and meeting that threshold. We are reimbursed $237 per assessment that we do. So that's money for the agency. Our Caregiver Program, which reimburses folks to take care of seniors in the community, that continues to grow. Our Caregiver Program itself increased almost 20% since last year. And we also are growing a grandparent program where we reimburse grandparents who are taking care of grandchildren. And we have more than doubled what we had last year. So that program is absolutely growing. During the peak of COVID, we held virtual caregiver support groups via Zoom that were well attended. We're increasing advertising to promote awareness of those programs. We have sent out flyers to schools and early intervention programs, ads on social media, church bulletins, and local news publications. We have an in-person caregiver support group that has been developed, and that's very well attended. It's held the third Thursday of each month at the Department of Human Services building at 5:30 to 6:30. And our caregiver support program has provided Thanksgiving food baskets to participants and Christmas food baskets and gifts to the grandparents who are taking care of grandchildren. Our Protective Services unit remains in the green. In calendar year 2021, we took over 1,400 reports of need. That was a 36% increase from 2020. And our protective service staff also participated in distributing bags to seniors in the community. Our current fiscal year compliance report for protective services has us at 93% compliant, which is compared to 72%, which is the statewide average. So we're continuing to hold a high standard. Next, I'll go into our vaccine efforts for last year. Our current consumer vaccination rates, we're trying to track the folks who we are working with to see who needs assistance. 70% of our consumers report being fully vaccinated, not including the booster. 10% have received the booster, 15% have declined the vaccine, and 14% have not disclosed. 1% have reported receiving the first shot only. So any seniors who are interested in receiving the vaccine or the booster, we're assisting getting them connected with locations in the community to get that done. We helped set up over 595 homebound vaccines in cooperation with local pharmacies in the communities. We worked with Wind Creek in 2021 when they were hosting their vaccine clinics. So we telephone registered almost 600 older adults for those clinics, and we actually worked in person at the clinics and helped register people in person for that. We scheduled over 100 vaccine appointments at the Hispanic Center through Capital Blue Cross. We assisted at 2 clinics at the Oliver Border House, also distributing fresh food bags as well to the people who came out for their vaccines. We funded Lanta rides for folks to get to their vaccine appointments. And we're currently working on an advertising campaign promoting vaccine availability. And that will be on WFMZ, in the Morning Call, Express Times, and billboards throughout the community. We have a 4-year plan that went into effect October of 2020. And so some of the highlights of those goals that we're meeting, even throughout COVID, is increased awareness of our programs by just increased advertising on social media and in print advertising. Person-centered counseling, which is a program that's relatively new for us. That's where we identify folks with a need, kind of like social work at its core, identifying their needs, presenting resources for them, and helping them to best support themselves and help themselves. So our goal for that is to increase 25% annually, and in 2021, we were able to increase participation in that by 50%. We've been hosting public information events and attending. I had the opportunity to participate in the House Aging Committee informational meeting. We've presented to St. Luke's Health Network Outpatient Care Management, Alzheimer's Latinx Community Forum, Aging Services presentation at Willow Green Retirement Community, a few senior fairs that have happened even throughout COVID. Most of those didn't happen. And also at the Northampton County Festival, we were out there giving out information. Another goal is obtaining and maintaining data integrity. And our goal is to maintain 95% accuracy. And as of November of last year, we were at 99% accuracy. And we have developed a consumer satisfaction survey that will be sent out annually to our consumers of our programs to just gauge how we're doing, what we could do better, what we could do more of. And that's all I got.
Well, let me just say thank you. That was an excellent representation of what you're doing and your efforts, and I appreciate it. I'm sorry, whenever we have Greystone on the agenda, it jams everything together. In fact, we may even cut Ms. Wondolowski out of the agenda tonight. But that being said, I want to try and end this quarter after, so I'm going to open it up to questions. And I promise you sounded a little nervous. People have to be polite or they're going to get shut down. This isn't like when I was director and a certain individual was on council and people were called corrupt and evil and all kinds of, Satanists. So we're not going to go there. But anyway, so I'm sure, I know I have a couple questions, but I'm going to open it up to council. Mr. Kusick.
Yeah, staffing, how are you doing there?
We're doing very well with staffing. We do have a few vacancies. 2 of those that we will be interviewing for. Our guardianship position, that staff person left. She actually relocated out of the state. So we're interviewing for that. And also an options care manager position we'll be interviewing for. We have 2 protective services positions. One is a brand new position and one just became vacated. And also an assessment supervisor position.
And you're not seeing any challenges getting those positions filled?
No.
Thank you.
Fortunately not.
Wait, hold it, time out. Are you finished? Yes, I'm done. Okay, who wants to be recognized? Mr. Myers.
You really didn't give us a number on how understaffed you are. You just started spouting out positions.
We have 1, 2, 3, 4, 5 vacancies.
Thank you. Okay, I have a couple questions for you. I got you at the mic. How are we handling anybody who has mental incapacities and needs advocates?
I'm sorry, I don't know what you're asking me.
Okay, let me try rephrasing it. If we have anybody that's in the aging department who's struggling with help or has to go somewhere and needs somebody to make sure the correct things are being done for them, do we have advocates for them?
Absolutely. Our care managers are trained, to do a full assessment of folks, and we also work very closely with the mental health division, which is physically right next to our agency. So we're able to have conversation with them if need be, make appropriate referrals if need be.
And is those programs being reimbursed by the state?
That would all be covered under our aging block grant. Mental health, I'm not sure about how they're
Aging
funding it.
block grant, and do you have an idea how much that is, or is Mr. Barron around for that?
No, Mr. Barron left the building.
Okay.
We can get that for you.
Yeah,
Okay.
yeah, we
All
can
right,
get
and the only other thing, when you get back to us, give us your total complement of what your staff is, if that's possible. All right?
Absolutely.
Thank you, Mr. Myers. Any other questions? Go ahead.
I don't have a question, I have a comment. It is a joy and a breath of fresh air to have you up here.
Well, thank you.
Because I remember 4 years ago, or is it 5 now?
4.
When you took over and the situation that we were in and just the successes. And, I wish there was a way to give you an award or to highlight you across the state, because the vibrancy of this department in particular is just so refreshing to hear. And I just want to applaud you and your staff for that.
Thank you very much.
I'm always concerned to hear about your protective services number, but it sounds like you really did find a lot of ways to make things accessible to people, even given the restrictions and probably with this high-risk population during the pandemic. So congratulations to you and keep up the good work.
Thank you.
And it doesn't sound like you're coming to ask us for anything. So if you need anything, let's know. I guess one quick question. The 3 centers are, you said Cherryville, Slateville, and I assume Palmer, correct? Is that where the senior centers are?
No, we have over 10 senior
Oh, you
centers.
have 10.
Yes, those were just the ones that hosted. It's a partnership with ShopRite and Cherryville and the Slate Belt Centers. They host flu shot clinics.
Do we have enough senior centers? Are there any requests for more or any satellite programming?
I think, I think there's always ways that we want to look at how we can enhance our programming. Right now, it's just so hard because we're so limited capacity because of COVID. But our programming has really enhanced. Prior to COVID, we were really doing an amazing job. Kim Nichols, our senior center director, getting our health and wellness programs up and running and up to speed and enhancing that, like with the lending libraries. Certain activities, we're trying to find ways to get younger seniors to be engaged at our centers. So we
Quit
can.
laughing, Cusick, you're almost there.
Before I go to
He's
Mr.
chuckling
It's just
there.
an oxymoron, younger seniors.
I'm on the cusp, don't laugh at
Before I
that.
get to
you,
Mr.
Lori.
Myers, is there anyone else who hasn't had a chance, has a question for Lori? If not, Mr. Myers?
Just a follow-up to you, Mrs. Wadanowski. We have tablets for the seniors in the centers, correct, still?
Yes.
And we have plenty of them, or do we need more?
No, we have plenty of them. And it's a lending library, so once the seniors are comfortable utilizing them, they can actually borrow them and take them home and use them.
Because while we're in there, we also have veterans that are senior veterans that are there, correct? And they're getting whatever else they need. We're making sure they get hooked up with the Veterans Department?
Absolutely.
As a younger senior, Mr. Kozak.
All right. Okay, we got a few minutes. I just wanted to ask, by the way, the senior centers we have, is that on on the website for your, so if somebody knows somebody or in your area, if they ask, you can get that information off of the Human Services part of the web?
Correct, yeah, it's on the AGE website.
All right, a couple questions, and you don't have to get into any real thing with it, but have you received American Rescue money,
Yes, we have.
your division?
Yes, we have. And we have about half remaining. We received over $877,000. We have about $420,000 remaining.
Okay, I mean, good, because I definitely, one of the most important agencies, and not just because of my age, it's just that one of the ways we keep people socialized and not going to Greystone, I think this is a buffer, and I'm glad that you've been getting money, and I hope if you need more money, that the administration is being very kind to you. Also, do you still provide ombudsman service?
We have contracted that service out, Catholic Charities now.
They take care of it?
Yes. And they're doing an amazing job. They have actually set the state standard for how engaged they are in the community.
No, I think that's fine. I mean, if you're satisfied, I think one of the problems we had in aging, and I've talked to Ms. Wondolowski about this in the past, was folks tried to do everything, and there were some things that just should have been, and we didn't have the staff to do everything. And so if you're satisfied, I'm satisfied. And I guess I want to ask you, what are your senior abuse numbers looking like? Because that's one of the things you do, go out and investigate reports of abuse to seniors.
Yeah, we did.
Have you seen any increase during this COVID period?
Yes, and our reports have increased 36%. And just looking at the benchmark reports from the first quarter of state fiscal year 2021, I'm sorry, let me look. Oh, I can get that information to you.
That's fine.
I don't have it broken down here, but yeah, the numbers have definitely.
But you have the staff to hand, I mean, you're getting on, I know you have a time frame. You're getting on those and you feel comfortable?
Yes, we remain compliant. Staff work diligently to meet those timeframes, not just for the sake of meeting the timeframes, but to make
No, I
sure
understand,
folks are safe in the
but
community.
You feel good. Yeah, and I would just say, again, thank you. Also, I know you don't get, aging has never traditionally gotten a lot of funding. You're not in the same ballpark as children and youth and mental health and MR. But if there's a need, and as this population gets bigger, please let us know, because people don't want to hear me say it anymore, but Human Services is a core function with elections, Mr. Kuzic, as a core function of county government, and it's one of the most important things we do. I think everybody that's been involved with the county knows that. So, a lot of the other stuff in some ways is a little bit of fluff, but your stuff is what has to be taken care of. So thank you for the report. Is there anybody else that has anything? It's my sensitivity thing. They don't want me to talk, so they turn up. Do you want to give a 2-minute, 3-minute?
I'll give you 1 minute.
Oh.
The good news is most of my original agenda was about all the props to Lori and her folks, and she covered that. So let me just give a couple quick updates. 1 minute is all I need. Drug and alcohol, I always am coming to you, I feel like every few months with more funding they got, and they got more funding again. Ask and you shall receive in drug and alcohol. So they got another 225, 30,000 that we are going to be able to add a few case management positions and with one, not the county positions, but with one of our contracted providers.
Yeah.
And we're actually looking at ways to incorporate a case manager for drug and alcohol from a provider and a certified recovery specialist in drug and alcohol into children and youth to help both birth parents who need assistance and youth who need assistance. I think making that connection will make it a much more seamless and accessible service. The implicit bias training that Mr. Myers usually asks me about, the Guillermo Lopez and his consultant group are continuing to do with our law enforcement. I wanted to let you know we did take a break over the holidays because it's just with schedules, this was just too hard for officers. But we added security staff from the Bethlehem Emergency Shelter and school resource officers and university, and NAC law enforcement or campus security to that group as well. So that work continues. Our contract with those folks to try to get all law enforcement trained goes through the end of June, our fiscal year. And Guillermo and his group are still trying to engage some of the departments that have been slower to join us or resistant. And that's not necessarily an entirely fair, but you said it, so. That was 1 minute, Mr. Heckman.
That's it. Any questions for the director? I mean, we got a minute. Mr. Myers.
Update on the Shiloh building.
Yes, sir, I got this update just for you. They, as all places seem to have had, they had some delays with construction because of supply chain issues. So the current update is that the construction is set to be complete in March, likely the end of March. And the end goal at this point now is to have the first set of folks in the facility by the end of June.
Just a quick update for the new members, what exactly we're doing at Shiloh.
Long-term structured residence, we've partnered with Shiloh Baptist Church. It is to get folks with serious mental illness who are lingering in jail, waiting competency evals or have been deemed incompetent, getting them into places that have a place that has treatment to try to either restore their competency or while they await their evaluation for competency instead of lingering in jail where they unfortunately can't get the necessary services.
It's not a long-term issue either.
Thank you. Anything else for the good of the order? Mr.
Yes.
Kersey.
Any updates on the civil service situation?
I don't like to jinx things. I will tell you that we handed the last 2 things that they asked for. But, because there's always a but. They are awaiting because we finally have a signed contract from previously, so we're hopefully getting close to finishing negotiations with PSSU. And as soon as I'm very optimistic about that, as soon as we get that across the finish line, we will be able to submit that, and that is, there really should be nothing else that they can ask for at that time unless something expired and we need to update it. So I'm really hoping in the next few months that I have a better update for you.
Okay, thank you.
You're welcome.
A motion to adjourn? So moved. We're adjourned.